Hi, I'm Jordan. I'm going to be your student nurse today. I'm from UAH. Let me just wash my hands before we get started. And if you could please verify your name and your date of birth for me.
Millie Brown, 2/18/2004.
Perfect. And before we get started, I'll be performing a PV assessment to check for arterial and venous circulation. It should take less than 10 minutes. Is that okay? Okay. Before I get started, I'm going to just ask you some questions. Have you experienced any cramping in your legs or in your calves while exercising or walking? Okay. Do you still have hair growing on your legs? Okay. Have you experienced any swelling in your legs at all? Okay. Have you experienced any varicose veins that you've noticed? Okay, that's good. First, I'm going to check your blood pressure and get your vital signs. I'll be checking to ensure that the bladder is 40% across and takes up 80% of your arm. The walking is snug but not too tight. I'll be performing the two-step method. First, checking for pulse going away. And pulse goes away at about 110. So I'll be pumping the blood pressure cuff up to 140. And I'm just get this cuff up. Your blood pressure is 117/70, which is in normal range. And then I'll be assessing your pulse. Okay, your pulse is 62. And first, if I could please get you to remove your socks and pull your arms and leg pants up. Okay. First, I will be assessing the skin for warmth and dryness. So the legs and feet are both warm and dry. And if I can see your forearms, they're both warm and dry. And if I can get you to flip them over, they're both warm and dry. And then I'll be assessing in between the fingers and the toes to assess for webbing, arterial circulation. And I'll be checking in between the toes. There's absent of webbing on all of the in between the fingers and the toes. And now I will be assessing for pressure ulcers and elevation pallor. So I'll get you to lie in the supinate position, and I'll lift the leg up, and there are no arterial ulcers on the leg, and I'll hold it up for about 15 seconds to let the blood drain from the foot and become pale. And then I will lower it, and the color does return to the foot. Then I'll do it on the other leg. There's no arterial ulcers, and holding it up for about 15 seconds. And then lowering it back down, and the color does return to the foot. And then I'll be assessing for independent rhubar. So if I could get you to sit up and hang your feet over the bed, not touching the ground, but letting them swing, and just holding it there for a couple seconds. And there's no independent rhubar. If I could get you to please sit back on the bed. And then I'll be assessing for under your nail beds. I'll be assessing for capillary urethra on all 20 nail beds, and I'll be pressing them firmly and then assuring that color returns under 2 seconds. The toes as well. And all of the capillaries return to back after 2 seconds. And then I'll be assessing bilaterally all of the pulses. I'll be doing your brachial or your arterial, your radial. I apologize. And they're both equal and normal +2. And then I'll be checking your brachial. They're both equal, normal +2. And then I'll assess for femoral pulse, and they're both equal and +2. And then I'll assess for your dorsal pedis pulse, and they're both equal and +2. And then I will check for your posterior tibial pulse, and they are also both equal and +2. Then I'll assess for the Allen test. If I could please have one of your arms, and I'm going to be holding down both the veins on the radial and ulnar side until the hand becomes pale. And then upon the hand being pale for a couple seconds, I'll release the ulnar side and allow the color to return back to the hand, and color does return back to the hand. And then I'll be assessing for venous circulation. So I already have your legs pulled up, and I'll assess for varicose veins, and both legs, there are no varicose veins on either leg. And then I'll also assess for hemostatic discoloration, and there's no hemostatic on either leg. And I'll also be assessing for venous ulcers, and there are no venous ulcers on either leg. And then I'll also be checking for pitting edema by pressing firmly down on the skin, and there is an absence of any edema. And that is all for your PV assessment. Is there anything else I can get you, Miss Melly? Okay. Well, your bed rails are both up ×2, and your bed is in the lowest position. Your call light is above your bed, and here are your personal belongings. And thank you so much for letting me be your nurse today. I'm just going to wash my hands on the way out.